Now this is a normal inflammation that I see right here. So that could be caused by any kind of allergen from working out in the yard, from like a cut to the skin. And so, like you said, what you're first going to see in this case of normal inflammation, and again, it's a normal reaction of the body, and it ultimately allows for healing. You're first going to see heat and redness to this area.
Okay.
And the reason why you're seeing this is because these little tiny arteries and capillaries in the area, so these tiny blood vessels, what they're going to do is they're going to expand and allow more blood to the area. And with more blood, that's why you have this heat and redness. Also, what you're going to have is the outer lining, or really the only lining of the capillaries. What's going to happen is they're going to come apart so that there are small gaps in between. So white blood cells can easily go out through these small gaps, exit the blood capillary, and enter the tissue where the infection is occurring. And that's what we want, actually. We want those white blood cells to escape the blood, enter the tissue, in case if you had a scrape and any kind of bacteria went into it, you want those white blood cells to be there so that they can engulf and capture any kind of infecting bacteria. What these white blood cells will also do is they'll initiate further steps of the inflammatory process, particularly through the immune system. So those white blood cells are going to recruit other white blood cells, allow them again to leave the blood, enter the tissue that's infected, and with that accumulation of all these white blood cells, you may see some swelling after a while, so within hours, let's say. So some of those white blood cells might release some chemicals, some special chemicals that initiate a pain. So that's why you might also feel some pain during this time. And again, this is totally normal. We still want those white blood cells there. Because ultimately what they're going to do is to help allow for the healing process to occur. They're going to remove any foreign substances. And once we have a wound form after, say, 4 days of the inflammation process, we're going to have like a red raised area, almost like grainy-like area. And deep to that, we're going to have a liquid-like substance that's caused by products of the blood. So, say for instance, if we get a scab when we're a child, that's the reason why our mothers tell us not to scratch our scab. Because by doing so, if we scratch it, we may open up the wound and allow for further infection to occur, and then the body has to do more work to close up that wound, and it really had already done that in the first place. So we're just kind of making things take a longer process. Exactly. So eventually, during the regeneration phase, after inflammation, the wound is going to start closing up from the outside and the middle, so kind of shrinking. And how it's going to happen is that outside of it is going to slowly be replaced by normal, healthy skin cells. So again, inflammation is a necessary process in order to get to that regenerative phase. But say if you want to go to the doctor and you're complaining about the discomfort, the itching, the swelling, what they might do to relieve your symptoms is prescribe to you an antihistamine. Now that antihistamine, what it's going to do is, yes, it's going to relieve the symptoms of the swelling, but also what it could do is slow down the inflammation process. So there's always kind of a reason why we have that inflammation there. So that's what I want you to know.
Okay.
So does that make sense?
It does, it does. So it's doing everything it should be doing.
It's doing everything that it should be doing.
That's what I wanted to hear.
All right, and within the next couple days or so, probably tops a week, week and a half, everything should be all healed up.
Very good. Well, thank you for taking the time.
All right, thank you.